Our goal is to treat the patients immediately, right after they get injured, and take them through a course of treatment to give them the best access to medical care and the best recovery as soon as possible. Patient gets injured on the job, they call their employer or their attorney, and they get a referral over to us.
Advanced Orthopedic Center, this is Allison. How can I help you?
Once the patient makes an appointment and is scheduled, which usually is done the same week, if not the same day, they're greeted by our friendly staff.
Hello, welcome to Advanced Orthopedic Center. Do you have an appointment today?
Yes, I have an appointment with Dr. Nissanoff.
Okay. Perfect.
At that time, they're given paperwork to fill out, which they also have access online to do. We have a website that has all the paperwork they're able to download if they have internet access and fill out all the paperwork on their way over.
Go ahead and have a seat. And the doctor will be in with you shortly, okay?
Thank you.
They're seen usually within 10 to 15 minutes.
Morning, how are you? Good, how are you?
By a board-certified orthopedic surgeon, at which time they have a complete history, evaluation, examination done. We also have in our practice an in-house transcriptionist that actually transcribes all of the documentation at the time of the visit. So when the patient walks out of the room, the report is actually complete, and it gets faxed through our electronic medical record system to the adjuster, to the referring physician, and to the defense and applicant's attorneys. This includes our own QME and AME reports, so there isn't a delay of several months before an attorney gets the report from us. Furthermore, the patient's disability status is known immediately on the report by the adjuster and by the attorneys that are handling the case. If the patient needs an X-ray or any other diagnostic studies such as a CT scan, an MRI, or an ultrasound, they are sent to the diagnostic facility within an hour's time, and we actually have a reading that we can see electronically through our electronic medical record system, including all of the documentation and the reports and the images. We review them with the board-certified radiologists and come to a diagnosis and a treatment for this patient. If we determine at that point that the patient needs conservative management, which we try for the most part to treat the patients conservatively and non-surgically, we have in our facility in-house physical therapy, acupuncture, and other modalities of treatment that the patient is able to access, again, the same day before they leave our facility. If we determine that surgical treatment is necessary, then we have an in-office, fully accredited operative suite that we are able to bring the patient into, have him undergo either sedation or general anesthesia, and perform the appropriate surgery necessary in order to complete the patient's treatment and get him well on his way for recovery. If at the conclusion of the patient's evaluation and treatment that day, it is determined that the patient needs prescription medication, we have an on-site dispensary and are able to dispense to the patient the appropriate prescription medication that he may need so that he walks out the door with the medicines and he doesn't have to find a pharmacy and wait for them to be filled.
Thank you.
Our system is very unique. It allows for a patient to get immediate access to care, to get the care that he needs on the same day, inclusive of all treatments and all diagnostic studies and medication necessary to cure this patient's ailment and disability. It renders a much quicker return to work, it renders a much quicker return to function and activities of daily living, and it closes the cases so much sooner than any other standard orthopedic practice, which allows the case to come to conclusion and everyone to get paid for the work that they're doing. For more information, you can call us at our office, area code 877-80-ORTHO, 877-806-7846.